Skin Renewal, a non-surgical solution.
The liquid facelift is a non-surgical alternative to a facelift and involves the use of Botox and dermal fillers, which are strategically placed around the face to address wrinkles, folds, volume loss and sagging. Botox relaxes frown lines between the brow, on the forehead and around the eyes, whereas dermal fillers are meant to improve wrinkles and replace volume loss in the cheek and jowl area. And then you can see what's happened with your nasolabial folds. Your malar fat pad has fallen slightly from there and it's landed up there. So if we give you just a tiny bit of filler in that fold, you can see how it just relaxes that whole area like that.
We're going to apply Botox into the forehead, to relax the muscles in the glabella area, which is this muscle over here. We're going to inject a series of little injections all the way up across the forehead to relax the frontalis muscle. And we're going to inject around the corners of the eye to relax the orbicularis oculi muscle to stop it from causing crow's feet. Then we're going to inject a tiny little bit of filler on the inside of the eyelid to try and hide the loss of volume that you have just below the eyes. It's going to hide the difference between the belly and the crest. We're going to do a very similar thing along the nasolabial lines, filling in a little bit of filler all along the way to plump up the area to try and hide the fact that the line has gotten a crevice. It also adds structural strength. Then going to add a little bit of volume along the cheekbones to try and lift the corners of the jowl slightly and to fill in a little bit of the volume that has been lost. So we're going to try and recreate that look without doing a facelift. See, what I'm aiming for is the actual circle. So I'm aiming for the needle to end up at the tip in that circle so that it raises volume there, like you see like that. Notice how we've lessened the lines on the forehead with the Botox, softened the crow's feet nicely. With the filler inside the lining of the eye, we've lessened the gap, the tissue lost, so we've just accentuated the cheekbone, which again also lifts up the jawline slightly. On volumizing inside the inner part of the cheek, we've allowed to lift the nasolabial lines just a bit, but still keeping them there. We have to keep somewhat of a natural appearance.